Remember that drama series, The West Wing? I simply loved it. A progressive president in the White House going through all the tribulations that these presidents usually go through. It was a well written series. But anyhow, Richard Schiff, one of the stars of that show, got COVID-19 as he worked in Canada, and he then got immediate exposure to the Canadian healthcare system, Medicare for All in Canada. I thought his little testimony, though what didn't go into a whole lot, the humanity in his statement just makes you wonder. Imagine if that is how we handled our healthcare in the United States, how much better it would be for most people. Check this out.
Richard, what would you tell your friend Joe Biden about your experience in the Canadian healthcare system? And I know already how much you love and how grateful you are to all those heroes who took care of you at Vancouver General.
Yes, they're great. They're loving on top of being caring and very efficient. And they're a bit conservative. I got into some discussions with one of the doctors. I had to fight to get remdesivir. Still don't know if that made a difference or not. I expect that it did. And they're very much a part of believe in the studies and in what percentages are good. They do not want to harm ever their patients. But the efficiency of the hospital, the cleanliness, the food was good. Was fantastic, and the fact is that I come out of there without a catastrophic bill, without a debilitating financial burden, and it's the first time I realized how wonderful that is to get sick, to go to the hospital for 5-6 days. It's a bill that in California would be hundreds of thousands of dollars, right? And I don't know what kind of copay I would be responsible for. I don't know how much my insurance would have covered or tried to wriggle out of. And here there is no worry about that. And everyone is treated the same. And they treat, I'm not a citizen of Canada. We have been working here for quite a few years on the good doctor, infusing a lot of money into their system, no doubt. But they do not discriminate against people that are not citizens if they have COVID. They treat everyone, they treat them the same. They follow up. I'm going back to a clinic in a month for them to check up on me. They've called me from the hospital. This is the kind of treatment.
Now think about that, folks. Imagine that the peace of mind you have if you got COVID, if you got any sort of disease, and know that in the aggregate, that's the kind of care that that having healthcare as a right gives you. And you know what? It doesn't make you some communist country. And you know what? It doesn't make you some evil country. It just says, I care about humanity. I care about people. And then listen to the thing that one of the ways that we have used to put people against Medicare for All, a similar system to Canada or other countries around the rest of the world, is to say, oh, you're going to take care of those aliens. You're going to go ahead and get rid of those. You're going to include illegal aliens, and we are going to have to pay for them. And what they don't tell you is around the world, Americans go ahead and use the healthcare system of all these countries that have a good social safety net where everybody is covered somehow, and they get to use the goodness of those systems. They pay the rates that the people over there are paying to use those systems because they never look at it as something, some capitalist venture that uses healthcare as a way to enrich just a few. They think about there's humanity in healthcare. You don't have your health, you don't have your humanity. I mean, why is it that we have allowed the few? Why have we allowed an evil plutocracy? Why have we allowed those selfish people that are just greedy to make us such a vile community when referencing healthcare or other issues that really is there to support us all? Why? These testimonies are important as COVID takes over, as COVID gets deeper, as more people get COVID and start to have the pre-existing conditions from COVID, damaged lungs, damaged kidneys, damaged brains, strokes, all these other issues. Yes, they're no longer on the dead man's list or the dead person's list. They are now just with a permanent chronic disease going forward. with a healthcare system that sucks, with a healthcare system that says, I will only help you when we know you're completely broken. We have already taken away all of your assets, everything that you own. It goes right back up the chain to the people who own the healthcare system, to the people who own all of this, to make you once again poor. Take everything that you have. Take everything that belongs to you, because that is what we do. We eat, we eat, we eat to grow for a few, to grow the wealth from a few by taking it from you. Thank you for that testimony. That is what we need more of. People to tell Americans how things really are around the world, where people have it much better than we do. We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead, number one, subscribe to our channel, and number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.